mitral insufficiency. Today, we will including anatomy, pathophysiology, Let's begin our journey into the world of mitral insufficiency. Mitral insufficiency arises from dysfunction of the mitral valve, situated between the left atrium and left ventricle. It is essential to comprehend the normal anatomy and function of the mitral valve to understand the mechanisms involved in mitral insufficiency, including leaflets, chordae tendineae, and papillary muscles. Causes include degenerative changes, rheumatic heart disease, infective endocarditis, and cardiomyopathies. Mitral insufficiency has diverse causes, including degenerative valve disease, infective endocarditis, rheumatic heart disease, and cardiomyopathies. Understanding these causes and associated risk factors is vital for effective management of patients with this condition. Mitral insufficiency alters blood flow dynamics and activates compensatory mechanisms. Backward flow into the left atrium increases pressure, causing left atrial dilatation and elevated pulmonary pressures. Left ventricular hypertrophy and neurohormonal activation are examples of compensatory adaptations. These factors contribute to symptom development and disease progression in patients with mitral insufficiency. Recognizing the characteristic signs and symptoms of mitral insufficiency is pivotal in the diagnosis and management of this condition. Students, we will explore the clinical presentation of mitral insufficiency, which can manifest as fatigue, dyspnea, palpitations, and even heart failure symptoms as the disease progresses. A thorough physical examination, including auscultation of heart sounds, is paramount in identifying the classic finding of a holosystolic murmur radiating to the axilla. We will discuss the significance of these findings and their diagnostic implications. It is crucial for physicians to have a keen eye and ear to detect these subtle clues in patients with mitral insufficiency. In this section, we will cover the diagnostic evaluation of mitral insufficiency. We will discuss the use of echocardiography, Doppler studies, cardiac catheterization, and magnetic resonance imaging to determine the severity of the condition and guide treatment decisions. Classifying the severity of mitral insufficiency is essential to determine the appropriate management approach for each patient. In this topic, we will familiarize students with the different grading systems used to assess the severity of mitral insufficiency. We will discuss objective parameters, including regurgitant jet area, vena contracta width, and effective regurgitant orifice area, and their role in quantifying the severity of regurgitation. We will also cover the limitations of these grading systems and the importance of combining clinical judgment and comprehensive echocardiographic evaluation. By accurately assessing severity, clinicians can make informed decisions regarding medical therapy, timing of intervention, and follow-up protocols. Mitral insufficiency can lead to various complications that significantly impact patient outcomes. This topic will explore the potential complications associated with mitral insufficiency, including atrial fibrillation, pulmonary hypertension, and heart failure. We will discuss the mechanisms by which these complications occur and their implications for prognosis. Additionally, we will examine the factors that influence prognosis, such as the severity of regurgitation and the timing of intervention. Understanding the potential complications and prognostic implications is vital in guiding treatment decisions and providing accurate patient counseling. Pharmacological management is crucial in mitral insufficiency. We will review treatment options, including diuretics, ACE inhibitors, and beta blockers, for symptom relief and disease progression prevention. Novel agents will also be discussed. This knowledge is essential for optimal patient care. This video focuses on surgical interventions for mitral insufficiency, exploring indications, techniques, and outcomes of mitral valve repair and replacement procedures. It also discusses minimally invasive and percutaneous techniques, enabling effective decision-making in patients with this condition. Effective management of mitral insufficiency requires adherence to evidence-based guidelines. In this topic, we will familiarize students with the current guidelines for the management of mitral insufficiency. We will explore the indications for intervention, including the severity of regurgitation, symptoms, and the presence of left ventricular dysfunction. Furthermore, we will discuss recommendations for follow-up, surveillance, and timing of intervention. Adhering to these guidelines ensures that patients receive optimal care based on the best available evidence. Students, you will gain valuable insights into the management strategies endorsed by leading cardiovascular societies and organizations. We will explore the challenges of managing mitral insufficiency in special populations, such as pregnant women, athletes, and elderly patients. Considerations for pregnancy, sports participation, and individualized care will be discussed, ensuring optimal management for diverse patient backgrounds. Mitral insufficiency research is an ever-evolving field with continuous advancements and promising innovations. In this final topic, we will explore the latest advancements and ongoing research in the field of mitral insufficiency. We will discuss novel therapeutic approaches, such as transcatheter mitral valve repair techniques and regenerative medicine-based interventions. Additionally, we will explore emerging technologies, such as 3D printing and computational modeling, and their potential applications in mitral valve repair and replacement. Staying updated on the latest advancements allows medical professionals to provide cutting-edge care for patients with mitral insufficiency and opens new avenues for future research. Condition requiring a comprehensive approach. Diagnosis, treatment, and research advancements of mitral insufficiency will be essential in patient care.